Where does that come with someone's healthy aging plan? And you kind of want to think about the time of menopause. You're in your 50s. Hopefully, you've got 30 years to go. And what are your medical risks? What's your family history? Do you have a family history of breast cancer? What are your habits, right? And what can you change? How can you be healthier? And what are the big three horsemen of aging? As Peter Attia, um, one of my mentors, I like to listen to him. You know, heart disease, cancer, and dementia. What are your risks for that? How can you reduce that? What's your overall health, your muscle, your bone health? What are your exercise patterns? And how can we get you healthier? What about your diet, your sleep patterns? And where does hormone therapy fit into that for you in terms of being healthier? And what are your personal breast cancer risks? I always talk to people about, you know, when were your pregnancies? How many babies did you have? How much did you breastfeed? Let's add up how much benefit you have from those things, because people don't even talk about those things. And then we can balance. And you know, hormone therapy, and you could just take it for a year if you're miserable, and that's not going to really cost you anything in terms of breast cancer risk. And you can make that decision every year. So, and it can be really miserable. And so, if you're really miserable, you can do therapy for a short period of time for very low risk. Who I told you about just come back from Europe, she just like, there's no other endocrine system that, you know, stops, and we just say, oh, you'll be okay, honey. You can live without that. You're fine, you know. And so it really is kind of illogical that we just say, you're okay, honey, you know. And there, I think it's the director of the menopause clinic at Yale just says, you know, the way we've treated this, we just have a very high tolerance for female suffering in this society, right? Is you're okay, you don't really need treatment. And we got really scared and we just kind of gave up. And so did the medical community.